USMLE style question on kidney-related erythropoietin, EPO, regulation. A 58-year-old man with a history of hypertension and type 2 diabetes mellitus presents to the clinic with progressive fatigue and pallor. His laboratory results are as follows. Hemoglobin, 9.5 gram per dL, normal 13.5 to 17.5 grams per dL. Hematocrit, 30%, normal 41 to 53%. Reticulocyte count, low. Serum erythropoietin, EPO level, decreased. Creatinine, 2.5 mg per dL, normal 0.6 to 1.2 mg per dL. Blood urea nitrogen, BUN, 38 mg normal, 720 mg per dL. Serum ferritin and vitamin B12 levels, normal. Which of the following best explains this patient's anemia? A. Autoimmune destruction of erythroid precursors. B. Fibrosis of renal peritubular cells leading to decreased EPO production. C. Suppression of bone marrow by chronic inflammation. D. Increased hemolysis due to osmotic fragility of red blood cells. E. Bone marrow infiltration by malignant cells. Correct answer, B. Fibrosis of renal peritubular cells leading to decreased EPO production. Explanation. This patient has chronic kidney disease, CKD, likely due to hypertension and diabetes mellitus, which leads to fibrosis of the peritubular interstitial fibroblasts in the kidney. These cells normally sense hypoxia and produce erythropoietin, EPO, to stimulate RBC production. With CKD, decreased EPO levels lead to normocytic normochromic anemia with a low reticulocyte count. Treatment, recombinant EPO therapy, epoetin alpha or darbepoetin alpha, to improve anemia. Why the other options are incorrect. A. Autoimmune destruction of erythroid precursors, seen in pure red cell aplasia, often due to thymoma or parvovirus B19. C. Chronic inflammation suppressing bone marrow, seen in anemia of chronic disease, which presents with high hepcidin and low iron levels. D. Increased hemolysis due to osmotic fragility, characteristic of hereditary spherocytosis, elevated reticulocyte count, jaundice, and splenomegaly. E. Bone marrow infiltration by malignant cells, would present with pancytopenia, low WBCs, platelets, and RBCs. Would you like more questions on renal physiology, polycythemia, or anemia mechanisms?